right now on Word Radio. In celebration of our founder, Walter P. Lomax Jr., MD, we're kicking off our Founders Day panel discussions with a conversation on violence as a public health issue. Brought to you by Keystone First, Colorectal Cancer Alliance, Love Philly, Love Delco, and moderated by host of The Source, Andrea Lawful Sanders.
Founders Day. Oh my goodness. You need to be down here at 1901 Vine Street at the Public Library, where we're honoring our special Founders Day founder, Dr. Walter P. Lomax Jr., MD. I happen to have met him myself personally shortly before he passed away. Never introduced himself to me as Dr. Lomax. He was just Bubby. And had this great conversation with me because he heard my Jamaican accent, and we got into this wonderful dialogue, and it just turned into something great. I had no idea when I met Dr. Lomax those years ago that I would end up being a host on WURD radio. And because of him, and because of the experience that I had with him those many years ago, every day that I turn on the microphone, I give it the very best that I have. I listen intently. I honor the people that call in, that take the time to call in each and every day, and I do my research. Sometimes y'all give mother a headache. Some days I get off the air and I'm like, well, Black Jesus, we're going to try another day, right? So, thank you to those of you who are here. Our sponsors are Comcast, Keystone First, PICO, Bank of America, Colorectal Cancer Alliance's Get to Know Initiative, Health Partner Plans, Dedicated Senior Medical Centers, Temple University, Lenfest, North Philadelphia Workforce Initiative, Mainline Health, the Business Center, Brown's Family ShopRite, Dietzen Watson, and Her Snack Foods, and Love Philly, Love Delco. Listen, I need you all to get down here. We're going to be here. Thank you all so much. We're going to be here from 9 to 5 today. There will be cooking demonstrations. You'll get to meet all the Word hosts that are here today. And if you're just tuning in, it's 96.1 FM, 900 AM. We stream live on wordradio.com, and you follow us on all social media platforms at OnWord. Let's get started, shall we? I am so excited about this first panel that we're having because if you have been watching or listening to me since the end of 2019, health is important. The social determinants of health is even more important. I also openly shared with all of you that I was diagnosed diabetic, and I have been managing it with just diet and exercise since then, without medication, because I asked the doctor what to do, but there are others who don't know or don't know what to do in moving forward. And so this conversation, violence as a public health issue, the panel is really important because it is discussing one of the most important health issues facing the city of Philadelphia, violence. Dr. Lomax's first career was as a physician who set up high-quality, full-service medical centers in traditionally underserved Black communities. He used to say that the number one health issue in the Black community was poverty. This was way before the phrase social determinants of health was coined. So much of Philadelphia's violence crisis is rooted in poverty and a lack of access to education, jobs, health care, and hope. The panel offers an opportunity to curate a powerful conversation that weaves together the mental, physical, and spiritual dimensions of violence and its impact on public health and our communities. We also hope that the panelists can offer solutions and actionable takeaways. Now, let's get started, shall we? I hope you're ready for me. I hope they warned you. Some of you have had the conversations with me before, but I'll start real nice and ask some broad questions, and then we're going to really go deeply into what's happening in Philadelphia. So let's do this. Let me, Sharrelle Barber, Sc.D, Director of Ubuntu Center on Racism, Global Movements, and Population Health Equity. She's a social epidemiologist. Oh, you are someone that I have always wanted to talk to. And scholar activist whose research focuses on the intersection of place, race, and wealth. Health, they missed something in here, and examines the role of structural racism in shaping health and racial ethnic health inequities among Blacks in the United States and Brazil. Our next person, Dr. Seun Ross, Ph.D., Executive Director of Health Equity Independence Blue Cross. She is the Executive Director of Blue Cross, Health Equity Blue Cross Independence. In this role, she develops and implements strategies and interventions to ensure equitable whole person health across Independence. Then we have Carol Penn, DO, mind-body medicine expert. Dr. Carol's unique background in dance and science with her expertise in meditation and movement allows her to focus on mind-body medicine, arts medicine, nutrition medicine, emphasizing prevention and wellness to optimize human potential. Then we have Joseph M. Gobern, MD, System Chair, Department of Obstetrics and Gynecology at Mainline Health. I've had conversations with you before from Mainline Health, so you already know what to expect, sir. I'm looking forward to that dialogue. Dr. Gobern is a gynecologist with advanced training in complex gynecological. Thank you. Gynecological and minimally invasive and robotic-assisted laparoscopic surgery, the Jamaican in me. Although he specializes in surgical gynecology, he's committed to providing the best possible care for each patient, which may be a non-surgical procedure or include medications. Praise the Lord. We'll take it. Then we have Trooper Sanders, CEO of Benefits Data Trust. Trooper Sanders is works for a nonprofit that uses data, technology, policy change, and direct service to help people to tap more than $60 billion in unclaimed benefits that support critical needs such as food security and health care. And I think that's it. Did I get everybody? So good morning to all of you. I wanted to introduce you formally, but we need to have a critical discussion about what's happening in Philadelphia as it pertains to violence and healthcare and the social determinants of health. Let me read a couple of stats to you. Last week, 53 victims were recorded shooting, 47 from the week before. 1,534 shooting victims this year, up 1% from last year. That was last week. We had 3 shootings alone yesterday at an elementary school. 352 year-to-date homicides in Philadelphia, again up 1% from last year. That was last week. That's since changed. The Criminal Justice Action Fund assessed 50 U.S. cities against 35 recommendations for comprehensive public health approach to violence prevention. Philadelphia scored 56 out of a possible 100 Americans experience concerns and views related to gun violence. And about 4 in every 10 Americans believe that it is at least somewhat likely that they will become a victim of gun violence within the next 5 years. When you hear those kinds of stats, and we talk about the social determinants of health, what comes up for you? Any one of you can answer that.
So I'll start with that. When we look at the violence, and again, my specialty is in women's health, which I've done for 30 years, and including obstetrics and gynecologic surgery, and where we meet patients. And one of the focuses that I think that we are realizing more and more, particularly in healthcare, is when people come through our threshold, that is still with them. The challenges that they face to bring this to attention, to seek care in the platform of healthcare, all of that are challenges which one faces. We train residents. We've had the opportunity to train physicians who are doing women's health across the country, and I sit on the board where we examine physicians to achieve that accomplishment. And in that, we have to recognize there's not such a thing as a non-compliant patient, which was common terminology. The questions we need to ask are, what are the barriers for you to be present, to be involved and engaged in your health care? It's a privilege today to be a part of this panel because I learn as much every time I participate in such an event, and I'd love to hear more about those others, because it's only new to healthcare that we reach out, ask the questions, number one, and then take the next step to find solutions.
You know, Dr. Gobern, let me follow up with you just for a little bit. It has been said that in our communities, in the Black and brown communities, we feel marginalized, and so it's difficult for us, when we go to the doctors, et cetera. And I've had many conversations with doctors over the years, whether it's, working through the diversity, equity, and inclusion initiatives with hospitals, schools, police officers, et cetera. It doesn't matter how much money we make or don't make. let me be clear. I told you I was going in there. Let me just put down my... It doesn't matter. It doesn't matter our station in life. It doesn't matter how educated we are. It doesn't matter how well-spoken we are. For some reason, particularly in healthcare, when we step into a doctor's office, there is this feeling of, I am doctor, insert God. You are the patient, insert nobody, and you better listen to what we have to tell you to do. So how do we navigate through those borders? And I need each of you to kind of like think about that as he's responding to me, because that makes a difference in whether we show up to get our health screenings. It makes a difference in whether we follow back up if we're told that there's something wrong with us because we don't trust the system, et cetera, et cetera. So how do we navigate around that?
So healthcare clearly is an evolution and growth. And there is a lot of history within our country, highlighted, of course, by the pandemic, which we've talked about incredibly, as well as the social violence that we're here to talk about today, that has elevated our consciousness in healthcare to be aware of that. We probably lag in healthcare to, again, understand what people bring to the table. But I think we have a responsibility both as healthcare providers and as patients that we have a common understanding at jump. That means when you walk through the door, what your goals and objectives for your care needs to be articulated. If you're dealing with a provider that has not established that, or you don't have the ability to establish that, you have every right to speak up. We need to understand and be confident to say, I don't understand what you're saying. We need to speak the same language. And so developing, one, is being advocates for ourselves. If you come with a family member as the pandemic rises and allows that, who can advocate for you, we encourage that. And for you to make notes to understand what is your problem. You don't need to bring solutions. You don't have to Google when you are paying someone or you entrust your care to someone. You need to bring your problem and expectations for solutions. And we need to listen. If your doctor is spending more time talking than listening, that's a conversation you need to further engage.
Did you all hear that? Okay, go ahead, go right on in.
Dr. Carol Penn here. I'm doubly board certified in family medicine and obesity medicine. One of the things that I encourage people to do when your doctor does not look like you, ask that doctor, what experience do you have working with patients like me that are my color, that are from my community? Just be point blank, be up front and out front with it. One of the big problems that we have uncovered in medicine again and again and again is the problem of implicit bias. And when the doctor is of a different ethnicity than you, the studies again show you don't get the same treatment. So for example, Black Americans, when you control for all variables, it doesn't matter. They're not going to be offered the same range of options, the same range of treatments, whether they're pharmaceutical or surgical as the non-melanated client per se. So it's really important to be upfront and say, look, I'm a Black woman. How much experience do you have working with Black women? Just ask the question. And if the healthcare professional is thoughtful and insightful, they will begin to examine the implicit bias that might keep them from giving you optimal care. But it's, you got to step out on that. It's a risk that you have to take. It's not a mystery anymore. It's documented, it's uncovered. You need to understand the consciousness of the person that you are asking to engage with your health care.
Absolutely, which means they have to do their research before they show up in the office. Dr. Barber, you're an epidemiologist. You're someone who I have been trying for a long time to have a conversation with. Share with us what trauma, constant violence within our communities, even if it's not visited upon us personally, what does that do to our emotional and physical psyche? And why are we seeing what we're seeing now in our healthcare system?
No, absolutely. So I think I'm actually really glad that you asked that question, because I think that, I wrestled with how to respond, and be present on this panel today, because I think that when we talk and have conversations about the real numbers and data, lives really,
Yes.
that the pain that families and individuals and communities go through, I think we also have to have a conversation about the structural violence that is exacted upon our communities and has been exacted upon our communities for generations and generations, right? And that structural violence and policy violence that causes our communities to have these concentrated levels of racialized trauma, right? And so it's the neglect, the disinvestment of education, of jobs, of quality health care, all of those things. And I feel like violence is a symptom of the very violent society in which we live. This country was predicated on violence. The extraction of Black bodies from West and Central Africa violently, the expulsion of indigenous people violently from their lands and genocide. And so and then the concentration of our folks, our people in certain communities through policy violence, that's not by accident, but by design. And so I think that when we have these conversations about violence, we have to put it in the context of the structural violence that we've experienced for generations in the city, in this nation, and in other parts of the world. And so we have the trauma from literally living in communities where decision makers have made it such that we, barely survive. Literally, life expectancy differences upwards of 20 years across neighborhoods here in the city. So you put a whole community in survival mode, and then what do you expect but an explosion? What's the poem by Langston Hughes? What happens to a dream deferred? What happens to dreams deferred in whole communities? And so I think that that analysis is really important because we definitely have to be dealing with the interpersonal levels of violence. We have to be dealing with the healing of people and communities and systems and structures if we're really going to dig into this. So as a social epidemiologist, I say, how do we think about the context in which this violence, how do we think about the fact that this is happening in the wake of a pandemic that disproportionately impacted our communities? The physical toll that took, the emotional toll that took, the economic crisis that followed the pandemic, all of those things are creating this situation within our city where, folks are desperate, communities are desperate. And so I think, again, it's not to excuse the violence, but it is to properly diagnose the violence so we can come up with multi-layered, faceted approaches to how we address it, because that's really important. The diagnosis has to be clear, right, so that we come up with the proper solutions at multiple levels. So I'm reminded of work of Dr. John Rich with the Center for Nonviolence and Social Justice. He's no longer with us here in Philadelphia, but he's him and his partner Ted Corbin led really important work. The work of the Philly Peace Park in North and now West Philadelphia, the work that Brother Tommy Kason is doing there. I think there are conversations that need to be had about the diagnosis, but there are also some really powerful models of how folks are thinking about solutions as well.
Thank you so much. Speaking of Dr. John Rich and his partner Ted Corbin, Dr. Seun, I have had in recent months healthcare workers on my radio show who are seeing gun violence victims just being dropped off and from cars, dropped in front of them. They are so impacted, they're so traumatized by what's going on with them. And this one particular nurse from Temple University, when she called in, she said to me, I keep asking, what can we do to make a difference? And the young men in particular will say, we just need a better life. We walk around with hoodies on our heads in 100-degree weather because we're afraid of who's going to shoot us. And the trauma that we experience walking around every day, it's kill or be killed. And so then we show up in the hospital and you're trying to give us solutions, but those solutions don't manage and work for us when we leave here and have to go back into the very systems that were created for us. How do you now, as you're dealing with diversity, equity, and inclusion within your systems, how do you then have those conversations with the people that are seeing the folks who are impacted by violence every day in a non-judgmental way?
You know what? I think that it is important, right, to understand that in order to make change, you have to actually go to the community and ask them how they need that change, how to do that change. I think for many years, we have had several health equity organizations spring up throughout the country, right? But our disparities keep getting worse.
Yes.
And I think that is a symptom of the fact that we think we know. We as healthcare providers have thought that we knew how to make that change, how to make that difference. What we neglected was actually going into the community and asking the people how they need that change to be done. So I think it's for those healthcare workers, right? All of this stress, the trauma that she was referring to, all of this causes weathering, and weathering is the stress of this just makes us sicker. It causes more and more chronic disease. So the only way, honestly, that we can make things better is to actually go into those communities. There's no other solution.
Right, and when you get into the communities, actually hear what the people say and implement what the people are asking for. Because another part of the issue that I'm seeing within our communities is we go in, we ask, and then we say, well, we know what's best for you.
You know what? I think that we often, society in general, right, create these pilots. And we say we're doing a pilot and it works here.
Yes.
And there's this little microcosm. The problem is that those pilots, the funding dies.
Yes.
And then all of a sudden everything stops. And so what we're doing, like at Accelerate, with Accelerate Health Equity, at one of the independents, I don't want to call it an initiative. We are partnering with organizations across the city. And if it works in one community, say it works in North Philadelphia, right? Then we can go to Jefferson, we'll say, oh, that worked. We're going to now start that same thing there. And we are scaling it across the city. I think we have to move away from doing things in these little silos and start working more globally.
Whew. We need more than an hour. Please keep track of time because I have 1,000 questions going through my head. But Trooper Sanders, we share a name. You are the CEO of Benefits Data Trust, a nonprofit that uses data, technology, and policy change. And you're saying that you want to help people to tap into the $60 billion in unclaimed benefits that support critical needs such as food security and healthcare. Please do share.
Right. Well, exactly. So across the country, there is more than $60 billion of help for people to get health care, to buy food, to go to school, to heat their homes. In Philadelphia, it's hundreds of millions of dollars that there are people eligible today, right now, who are hungry, who are going without checkups, who are afraid for the winter and how are they going to heat their home. And there is help available. Yes. My amazing colleagues, the vast majority of whom are Philadelphians. I'm from Michigan, as they say. I'm earning my way to being a Philadelphian. I'm earning my way. Yes. But we've worked since 2005 to help connect people to those benefits right here in the city.
So wait, Trooper, why are we Okay, I'm putting
why are we here?
Why are we here? Exactly. Right. Why are we here? To whom does it serve that there's millions, hundreds of millions of dollars of benefits available to our citizens? I can't tell you how many times I've gotten calls of people who say, my electricity is going to be shut off, Andrea. My water bill, I can't afford to go to the doctor, Andrea. And I spend nights upon nights upon nights calling my people and asking them, who can support this person?
Right.
When hundreds of millions of dollars are sitting unclaimed. Now, I need you line by line, precept by precept, to tell the people how they can access this stuff. They're sitting here and they're listening.
Yeah, well, a couple of things. I mean, one, and I think it goes to the earlier point, when many of these programs were created, frankly, built in the DNA was complexity to deter people, to keep people out.
Such as what? Tell us what those complexities were.
Different. Well, frankly, we created this boogeyman that there are all these folks out here who are hungry, who are trying to defraud the government, when in fact we've made it so difficult for folks who are eligible
to access
it. So it would be like, there's a great grocery store up here. I won't say the name because they aren't a sponsor. And it would be like if we're going into the grocery store, you had to get patted down, although that may exist in some grocery stores, let's be honest about that. But if you had to do everything before you just got to the food, as opposed to be inviting, come in, we want you to buy our food, and we have some security, but you barely notice it. And for folks who need to be worried about it, they'll get caught. But everybody else, we want you to buy the food. So we've built these programs in a way, and in some cases, let's also keep in mind, there are certain structural issues But there are also a lot of public servants who work in the city, who work in the state, every day trying to connect people to benefits. And we all know in our jobs, there's all sorts of complications and everything that's built around it. So my colleagues are working every day just to cut through that, to help people. So if they call us or engage through one of the community organizations, we can help. We're also trying to figure out the structural issue.
So I'm listening to you. I hear you. I hear you loud and clear.
Yeah.
What is sticking in my craw now as I'm listening to you is that the system was developed in such a way that deterred people for so long that even when you clear the muck and the mire to get them to the services, how do you then get them to trust you at this particular point in time?
Yep. I mean, it's the combination of factors.
Okay.
There's complication, then you overwhelm public servants who are clocking in every day trying to do their job. And then if you think about the other social and political issues, if you don't trust a system already, if you've experienced a system in a way that has not been fair, why are you going to go knock on a door and say, wait a minute, I hear there's some support here that I am eligible for? And we face this every day, where even in our outreach to people, we'll say, look, there's hundreds of dollars available to help you buy food. And folks say, wait a minute, there's not $100 of anything waiting for me. That is not how the world works. And I want to connect it to the violence question. The whole point of us having a society is because we are safer together than apart. That's why we created a society. That's why we created a government. And then we created laws and constitutions to hopefully make it just. That's a work in progress. But this issue of chronic violence, and also violence against women, and let's also make sure that with the gun violence, there's the epidemic of domestic violence and violence against women and girls. It tears at the fabric of who we are as a society. So for someone like folks we help, it's like, great, we helped you get SNAP, so you can go buy a bag of groceries. But now you're scared to go to the grocery store.
Absolutely.
Or, you know, you may want to make something, you're like, gosh, I don't have that bell pepper, but you know what? The sun is going down. I'm not sure. So let me just go make something that doesn't involve a vegetable. All of those things feed into one another.
Dr. Walter P. Lomax Jr., MD, was very concerned about poverty. And I am grateful that, as you know, as one person, that he started this radio station that would give us the voice to do the things that we need to do. This conversation is so important because poverty and all the isms that are happening within our communities is what's literally killing us, right? And the young people that I'm having conversations with say it all really got out of control when COVID hit. And we realized that there weren't the services there, that people were knocking to try and get their COVID vaccines or to get tested, and they were being turned away and said that they had to have a doctor's note. But they saw white people coming in droves, and yes, I'm being real clear, coming in droves to get the vaccines, coming in droves to get and so we know the services are there. And yet we were being blocked from having the services. To whom does it serve that we stay in a state of trauma? Who does it serve? Because you tell us it's here, you tell us we should come and access it, and yet when we show up, you push us away, even with the monkeypox vaccine. My son called me, he said, I'm in the Bronx, and I see lines and lines of white people, and the black folks are being turned away. And we keep saying we need to do better, and we need to be better, but Ms. Epidemiologist, please tell us, what do we need to do to shift and change the narrative? And then I'm coming back to you, Mr. Sanders, because I need you to tell the folks how they can access these services. All right, thank you.
So there's so much to unpack, But what I want to offer, because I am a professor, I like offering definitions that I think are helpful for us to think about these things. So Dr. Kamar Jones, an epidemiologist who's been doing work on racism and public health for over 3 decades, has a definition that I think is useful, that helps us situate what's going on. So she says, racism is a system of structuring opportunity and assigning value based on the social interpretation of what we call race, which is, again, a social construct. And it does 3 things. It unfairly disadvantages certain individuals and communities. it unfairly advantages certain individuals and communities, and it saps the strength of the whole society through the waste of human resources. Right. And so when you talk about the isms, when you talk about even poverty, I think we should also even use the language of systemic poverty, because it is poverty that has been created by the systems and structures, right? So when you talk about kind of the dual systems of systemic poverty and systemic racism, we're talking about systems that some people benefit from. Some communities benefit from, as you said, white people benefited, from, different things in terms of access to healthcare, in terms of housing, all those things. And so we have to interrogate, so why are our communities less valued, or why do we, have to experience all of these disadvantages? And, white folks, white communities, what is your role?
Right.
In kind of shifting the power, resources, et cetera, so that we do have an equitable society, because at the end of the day, it saps the strength of the whole society when we're not addressing these issues. And I think COVID-19 actually made that pretty clear, that yes, there are communities that have been most harmed and most impacted, but the fact that we had so many inequities was bad for all of us.
Yes.
You know what I mean?
Yes.
And so like in this moment where we're quote unquote, we're not post-COVID, by the way, but in this moment where we've had to sit with all these things, my question has been like, how do we come together to talk about the solutions, repair harm from the past? Because again, these issues are byproducts of this system and structures that we've created, right? And so I do think, I don't even remember like all of what your question was, but I do think it's important to think about systemic. Again, why haven't we passed a minimum wage or a living wage? That's poverty. That's poverty that's been created. When we can send billions of dollars to CEOs and other folks, in the middle of a pandemic, but we can barely get cancellation of student loans or, so all of the, again, these are questions I think we need to be asking ourselves. Like, we have resources when we want them, but where are those resources when they need to go to the communities who've been most harmed for generations in our country and in our city? So I think those are the kinds of questions, because it doesn't have to be this way. I worked some with the Poor People's Campaign on a national level. Dr. Barber, who happens to sometimes be my dad. But again, he talks about the systems and the structures and the policy neglect at the national level, but also state and local levels, right? So again, I think, this issue of violence has to be put in that context of all the policy violence that has been exacted on our communities, the neglect, the harm, and then the question is, how do we heal?
Right, and so I'm glad that you put violence in that context, because I wanted people to see the trauma, but that the violence, the real violence that's happening in our communities are the systemic things like putting children in schools filled with asbestos and, waters, stuff that makes their brains not work properly, and then they go to the doctor and the doctor says, you're not smart enough and you need to be in special education, and only for those same black and brown children to go off to college, and black women are the number one top earners of Ph.D.s in this country. So you knew back there in kindergarten through 12th grade when they were telling you were not smart enough. But here's the thing that comes along with this, and I need us to discuss this. The trauma that follows us in our DNA as a direct result of being born and consistently being fed that we're not good enough on any level is demoralizing, dehumanizing, and then we see the typical violence now that's being played out where people are being shot and killed all day, every day. We have to hold the systems, the people in charge of those systems accountable. Does that make sense? Yes. Absolutely makes sense. Okay, somebody over there clapping, all right. So, Mr. Sanders, how do people access this hundreds of millions that's in Philadelphia? Because I have to ask. We need to know. Listen, anybody else can interview you and you can have a good conversation. I'm going right into the rooter. I'm going to the meat of the matter. We've got to have some solutions for these people. So, how do we get folks to access the hundreds of millions that you're saying is out there?
Well, first of all, I didn't bring it with me.
Well.
But practically, folks can who are out there who need help and who think they might be eligible should call what's called the Benephili line.
Get your pens. Hold on. Give people a minute to get their pens.
That's all right.
Pull out your phones. Get your
right.
pens, and somebody share it with me after, because I've got a bunch of people I'd like to share it with.
Got it. And I should say that my colleagues at BDT, they do an amazing job, but we do this work with the city, with the state, with community organizations all across the city. So the number is 844
844
848
848
4376.
4376.
I'll say it again.
All right.
844 848 4376. And there are folks who will talk to you, will ask you a number of questions to see if you're likely eligible. But I would also say the other part, and this goes to the stress that's around so many things, is, Franklin Roosevelt used to say, "I welcome your hatred and turn it into energy." Now, that may be a bit difficult when there's so much hate. But I do think there's a bit of like, damn it, we're not going to be denied.
Yeah.
So yes, please do call us for help. But the other part is, we know we have friends and loved ones who are like, I can't make that one more call.
Oh, yes.
This is not going to work out, so I'm not going to apply. Providing just that bit of nudging and support, because, there are many folks who do claim what they're eligible for. And so that's a piece of it. I'll also say that, for the work that we do, it's about buying a better bag of groceries, getting the health care that you need. But I think about it in this structural way. The most important thing that we could do to end intergenerational poverty and violence in the Black community is to invest in Black girls. If you can get Black girls who are in middle school right now into algebra on that academic path to frankly be like the amazing folks on this panel, that's what breaks the cycle. Now, how do you do that if your house is cold? And who's also going to help you often? It's your parents, but it's grandma and grandpa. Now, how can grandma and grandpa help you if they don't have a bag of food to eat? But imagine the multiplier if we can help seniors, if we can help every grandmother and grandfather in this city get SNAP, get a better bag of groceries, to have a bit more strength, a bit more nutrition, to be able to support the grandchildren, to get them to the programs they need, et cetera. It's one of the pieces. It doesn't address the violence question. It doesn't address the policy violence question, but it's one way to put the hundreds of millions of dollars to work.
Right. Well, thank you. Dr. Carroll, mind-body expert medicine. Yes. I have had, so we talked about the social inequities that are happening in our communities. I'm coming back to you about Black women and how we're losing our babies, and pregnancy and how we're treated, what that looks like for us, and what we're dealing with today. But oftentimes we are Africans. We're from an African culture, and we know there are certain things that we can use. Doctors don't believe in anything other than the pharmaceuticals that are pushed out there. But when I was diagnosed with diabetes, I called my Jamaican people and I said, tell a sister what she needs to do. I have to talk to my doctor. Tell me what I need to do to not be on medication. And she said, Andrea, if you can promise me you do this, I lost the weight, I ride my bicycle 500 miles a week, all of that, and I stay away from stress. Because stress will kill you. And people will visit stress upon you just because they think they can. Talk to people about what are some of the things we can do that won't cost any money to relieve ourselves of some of the stressors that we have to deal with every single day. Can you do that for us?
Yes, I can. Thank you so much for that question. So one of the things that I like people to know is, what do you have control over? What can you have agency over right here, right now, before you get to the doctors, or when you get to the doctors, in conjunction with whatever advice or recommendation that you might have from your medical professional? One is, you must manage your stress. Now, what are the ways you can manage your stress? There are ways that you can learn to manage your stress through your breath, breath work, meditation, and I'm going to say contemplative movement practices, wisdom traditions that the world renounds. So some of the contemplative practices that you might be more familiar with are practices like yoga, or Tai Chi, or Qigong, or even Capoeira, which is one of Brazilian martial arts, African martial arts, a combination of the two. And the base and the root of that is your breath work. And the breath work taps into balancing your autonomic nervous system, which is where? Between your two ears. This is what you have power and agency over, your sympathetic and your parasympathetic. So you have your sympathetic system that's putting the gas on. We need a little bit of that, or else we would never get out of bed in the morning. Then you have your parasympathetic, which is your rest and digest, your relaxation. This is your body's own natural cornucopia. This is where the medicines of the bodies are made, in your brain, in your central nervous system, connected to your gut. In your gut. So what you're doing when you learn how to use your breath, when you learn how to use the contemplative movement practices, is you are telling your brain to release dopamine, oxytocin, serotonin, and endorphins, and this is why you will feel better. This is why you will be able to connect with much less stress to a family member, or in the boardroom to a colleague. And this is available to you. It is simple, yet complex at the same time. This information right now is free. The question is, will you do it? Will you take the moments every morning to wake up, and instead of hitting the snooze button, to say, I'm grateful.
Yes.
Give that message to your mind.
Yes.
I'm alive.
Yes.
Take that deep breath in. When you take the deep breath in, that activates your sympathetic nervous system. When you exhale, that activates your parasympathetic nervous system. So it's with every breath you take, you know how loved you are, how beloved you are, and to whom you belong every time you breathe in and breathe out. Now you can learn how to activate this in a very, very powerful way that reduces your blood pressure, lowers your blood sugars, and increases the ability of your DNA to maintain the telomeric structure, which is attached to your longevity. This is all evidence-based. This is available to you, and it's free. So I hope that you will take your next breath right now with this knowledge, all right?
Isn't that great? That is awesome. Absolutely awesome. I am grateful to all of you. Thank you. Gratitude is something that is huge in our household. I'm grateful to all of you for sitting here. But I now have to ask you this. How do you manage the traumas that are oh, you thought I was just going to talk to the people, huh? How do you manage the traumas that are visited upon you as people of color in your roles every single day? And what advice can you offer those of us who are sitting here, and how to navigate through? Because it's hard. It's challenging, I should say.
It is challenging, and I'd like to thank Dr. Penn for her guidance and suggestions. It's probably things that, as I listen to a lot of the medical detail in there, and that's a world I live in and understand the language, it's very similar to many of the antidepressants that we prescribe in the office. And to know that we can get that for free, to know that we can produce that in our own minds is fantastic. And how do I actually use those techniques, those breathing and relaxation techniques? I have to recognize and refocusing in my breath, what is my purpose? And my purpose is greater, and I believe probably every member of this panel, not to speak for them, would believe in that our purpose is greater than that. And we should not, at least I try not to travel alone. If I am going across the threshold to whatever that greatness, promotion, whatever that succession plan is, that there's someone that's going along with me, that there's someone I'm going to mentor or grow. Of course, I had years in the military before that was just part of our process of developing others. But if I could take liberty just to step back to some of many of the other points made by both Dr. Ross and Professor Barber, in that this is structural. And if we don't understand, and the weathering that you alluded to that impact maternal health and other things, all of these structural and process components that impact us, those have solutions, but it's not just us in the room. And we realize that there's leadership in our politics and legislation, again, that the professor has alluded to, that controls that. It is probably, I couldn't say more effectively how important voting is for us to have a place. If you don't know, and if I can say again, don't go alone. If you don't recognize how important voting is, if you look among your leadership and say, I don't see me reflected in that, then you need to vote, and you need to be there so that you're reflected, like when you walk into the office and find a provider that can identify and connect with you, who can identify and connect with you, who can produce policy that's going to impact you, that's going to impact your family, it's going to impact generational growth. We need to vote.
Yes, sir. Thank you. Couldn't have planned this better myself. Moving right along.
So you named the name of our center, which is the Ubuntu Center.
Yes.
Ubuntu is a South African principle that literally means I am because we are. And so when you say, how do you deal with the trauma, carry the trauma, however, it's in community. It's with people. It's by recognizing our interconnectedness. And I think that's how we've made ways out of no ways in the past. Our people are about community. We heal in community. Very personally, sometimes you just have to let out the tears. You just have to let them out.
Thank you.
You just have to let them out and not be afraid.
Thank you for saying that. Tears are cathartic.
They are, and I want to recommend a book that I've been reading called This Here Flesh. It is amazing. It's on liberation, spirituality, and the stories that make us. A really powerful sister who's just, inviting us into spaces of both acknowledging harm, but also joy and restoration and rest and things like that. Rest, sleep. I don't know if you know the nap ministry at all, but those kinds of things. But I do think that community has to be at the core of that. And even in some of the community-led solutions against violence, for example, the Peace Park, some of their work around kind of urban gardening and using kind of the land as a healing practice and understanding our interconnectedness with the land in their practice and teaching that to young kids. And those kinds of things are all healing because they connect us to one another, they connect us to creation. And I think we sometimes lose that. We've lost touch with just being and existing and recognizing what exists around us. And I think that's really important if we are going to have the battles and if we're going to, kind of gird up to do the work that we need to do against these systems and structures, we have to do it in community.
Thank you. Dr. Seun, now you've been kind of quiet, but that's because we've been talking all sorts of other things around you. Tell us how you manage through the traumas of your work.
So you know what, in my role, I see the real time effects of this. I see the disparities, and I get really angry. Day to day, I am angry when I hear of people who have kidney disease, right? And it's allowed to get worse because they haven't reached a certain stage yet. Like we are very reactive versus proactive.
Right.
And so I utilize a lot of the things that Dr. Penn said. It is literally being very grateful all the time, waking up and saying, I thank you, God, that I am alive, my family is alive, etc. Yoga, working out a lot, sleep. And then actually disassociating from all of this and just reading a book.
Come on. There
I
you
think
go.
it's important, right, that we don't we're not always in it,
Yes.
that we find time to do things that actually make us happy.
Yes. All right, Mr. Sanders, the man with the hundreds of millions of dollars.
Well, there you go.
Did you get his phone number? Because that's a solution. Okay. Go ahead. You wait. They're going to call you.
Well, please do, because I have some amazing colleagues, and even in the worst days of the pandemic, we didn't miss one day of work, including colleagues who were dealing with all sorts of things in their own lives, because they're like, we got people to help.
Yeah.
And they're so committed. So that energizes me. So I have no excuse. Like,
Right.
I just have to make sure not to mess everything up. So, if my colleagues who are on the phone talking to people are
Yes.
doing it, I guess the other part is, amidst all of these other things, is also, I'm reminded that joy and happiness is an act of defiance.
Yes.
Just showing up with a smile.
Somebody write that down for me, please. Joy and happiness is an act of defiance.
There you go.
Absolutely. So we've heard gardening, put your hands in the soil. We've heard yoga. We've heard breathing. We've heard taking someone across the threshold with you, right? Just walking through, having someone walk through with you and not sitting in loneliness and trying to figure it out on your own. You're last.
All right. So for me, one of the events of the last few years really uncovered a deep rage and anger in me. And so I have cultivated my anger into activism, because this unexpressed anger was going to become quickly detrimental to my health. So for example, I just returned from Buffalo and working with the families of the victims of the racially motivated crime against humanity that took place on May 14th. I continue to work down in Broward County with the community that was affected by the Marjorie Stoneman Douglas massacre of 2018. So for me to be engaged, to say, well, guess what? It's not going to change unless you do it. You better put on your big girl panties and go out there and do it. So my activism is a part of the expression of my spirituality and my relationship with my higher power, my understanding of my higher power. So I do encourage that in others, but I also support others who are actively engaged in this work, because it will take life away from you. And I do that through meditation, through contemplative movement, and very critically and importantly, you know something about this, food as medicine. We are what we eat, and you have to be mindful of what you're drinking and what you're eating and how you're treating this temple. So all of the above to all of my colleagues, and a reminder about the importance of our relationship to the earth, the environment, and what we're bringing into our body in mind, body, and spirit.
Did you all get something out of this today? Did you learn about the social determinants of health here, how violence is visited upon us, not just through a gun, but through the daily systemic things that are happening with us in our communities? Did you learn how to take a deep breath? Did you learn that there are hundreds of millions of dollars sitting around waiting for you? Did you learn that you can turn your anger into activism? Did you learn that you are just as powerful right where you're sitting today in your own way? Did you learn all of those things? I don't hear you. Yes. And what is so beautiful about this panel discussion that we're having is this is everything that Dr. Walter P. Lomax, MD, Jr. was about. Everything. The man, there's a saying we have in Jamaica, walk humble but carry a big stick. The man had an incredible amount of wealth that he passed on. He's gone, he's been gone, but that wealth is still spreading amongst us years later. That's called leadership, people. That's called taking what you have and understanding that it was not just for you, but the only way you're going to change humanity is to be that change. Dr. Walter Lomax Jr. was just that. And so I am absolutely grateful to sit here with all of you, to have this first panel discussion. I hope that when you get off of this stage, you are forever changed. Talk to some of the people here. They know everything. Trust me. Anything you want to know about Philly, 5 minutes, I know. So listen, we've got to go. This is our second annual Founders Day at 1901 Vine Street in Philadelphia, where our sponsors are Comcast, Keystone First, PICO, Bank of America, Colorectal Cancer Alliances, Go to Know Initiative, Health Partner Plans, Dedicated Senior, and on and on. I just want to say thank you to my panelists, Sharrelle Barber, Sean Russ, Ph.D., Carol Penn, Trooper Sanders, and Dr. Joseph M. Gobern. Thank you all so much. It was a pleasure having the conversation. Don't leave. I'd like to spend some more time talking to all of you.